Well, a warm welcome to this talk. Lots going on in the world at the moment, of course, in terms of threats to our health and well-being from many sources, some organised, some less organised, some conspiratorial. But I want to look back today at things that have gone on over the past 4 or 5 years. Now, you probably saw the video I did a few days ago with Professor Robert Clancy, who's one of the key authors with Dr. Mel McCann on this book, COVID Through Our Eyes, written largely from the Australian perspective, but covers a lot of useful ground from a lot of useful people. Now, I want to read out the foreword of this, because this is what I wrote for this book. Now, I'm not a very good reader because I'm a bit dyslexic, but I thought we'd have a go at it because it covers a lot of ground. Now, looking back, it's really hard not to, well, of course we do get cross, we do get angry. We get cross at the lies. We get cross at the, more than cross, we get infuriated, the lies, the deceit, the manipulation, the distorted use of science, the people that died after getting too much midazolam and morphine, the vaccine injuries, the people that died after vaccination, all the stuff that goes with the appalling COVID debacle times. Good thing about it is we now realise how we are led in a more realistic way than we ever did before. But I think I'll read this forward. If you want to sort of listen, you're welcome. But it kind of puts things in a logical way, because it's easy to get mad, it's easy to rant, and of course that's right, that's justified. But sometimes you need to try and tie it down a little bit. Now, it's related to what's in this book, but it's of general applicability and vital importance for the future. So let's give it a go. This book is indeed a timely publication. We can now look back over 4 extraordinary years, getting on for 5 now, of course, what might be termed the pandemic years. We are also at a vital crossroads. Powerful individuals and groups around the world are planning their ongoing strategies, plotting the way ahead into the future of their preference. The problem is, of course, I have not been consulted, and I suspect you have not been consulted. We are at risk from these vested interests. The chapters of this book are written by experts from many fields: academic, medical, clinical, legal, political, journalistic, economic, regulatory, pharmacological, and sociological. The reason the text is so convincing is that from these divergent areas, consensus emerges. Epistemologists from essentially different paradigms of thought arrive at common conclusions. This provides mutual confirmation of the important principles and specific points identified. And if you haven't got time to watch the rest of this video, some of them aren't very good. Before further consideration of why this publication is so imperative, indulge me as I share some of my personal experiences. I was a nurse lecturer and researcher for over 45 years. I, like most of us, worked in a hierarchical system. I received instructions from those senior to me, and likewise passed on teaching and duties to colleagues and students around me. Medical consultants would prescribe care, and I would implement that care for the benefit of my patients. For the most part, these prescriptions seemed to be the right thing to do given the current state of knowledge in a particular area. When I was unsure, I could discuss care with senior colleagues. Often my concerns would be allayed by further explanation. Occasionally, care would be changed or modified as a result of my input. However, over my career, decision-making moved away from medical opinion to the implementation of policies and protocols. Guidelines and treatment protocols would be issued by various national and international bodies. As these guidelines became more numerous, the role of clinicians changed into that of protocol and guideline followers. I found most of these guidelines to be a reasonable interpretation of current research and thinking, but often put together by groups of leading experts in the field, which is good, of course. At this stage, it made sense to base care on the best available consensus. So, the pandemic arrived and guidelines were given by our chief medical and scientific officers. We continued on with the tradition. Surely, these national and international policies must be based on the best available scientific and medical evidence. The authors had full possession of the facts, so they must know best. Therefore, for the first part of the pandemic, I believe the information passed down to me by my betters on high, as I had done for the full career. However, over time, questions arose in my mind. Contradictions were observed, inconsistencies identified. National and international protocols started to contradict my understanding of what at times were fairly basic scientific principles. Obvious common sense advice seemed to be ignored or denigrated. For example, I reasoned it was obviously a good idea to optimise the immune system, and of course natural immunity would follow. Why wouldn't you want to use your natural immune system? Stick to the text. I also started talking to people around the world and wondered why so many were telling me about their often severe adverse reactions to vaccines, which were safe and effective. Why was it that highly experienced senior clinicians in several countries were reporting dramatic success and great treatment outcomes with inexpensive, repurposed medications? As these inconsistencies accumulated, my thinking became more questioning, more analytical. You could even say more conspiratorial in the best possible meaning of that word. I started to recognise further problems and questions. Were regulatory bodies fully objective and independent? ? Was vested interest having an undue effect on policies? ? Was the official narrative the only modality of thought? ? You can see I'm trying to keep it cognitive in this write-up. Progressively, discussing these issues with brilliant thinkers in many countries, and we interviewed many great people on the channel, leaders in their fields, in many countries led me to reject some of what governments and officials were dictating. Realising that our leaders might be issuing suboptimal diktats was uncomfortable. Suboptimal. In England, if you're watching in the States, we tend to understate things. Changing my mind from simply accepting top-down directives to analysing and discussing them with others was demanding and time-consuming, but often seemed to lead to better conclusions. Then there was the censorship. Some of my online interviews with leading scientists and doctors were censored. A video with leading physician Dr. Pierre Corey on ivermectin taken down. An interview with British politician Andrew Bridgen caused me to have a YouTube strike, short-term ban, merely because he mentioned the words hydroxychloroquine and ivermectin. I'll just put in parenthesis there that YouTube is actually much better now and much more open to these ideas. But at the time, that's what happened. A colleague in Africa was censored for mentioning the possibility of local herbal therapies. While COVID vaccines could be mentioned, any negative discussion was sanctioned. Before Mr. Musk took over Twitter and Facebook, before Elon Musk took over Twitter and Facebook were more heavily censored than YouTube. So Facebook and Twitter in the pre-Musk era were heavily censored, controlled and, dare I say it, fact-checked. To me, this represented the antithesis of science, which progresses via dialogue, debate, thesis, antithesis, and synthesis. And so it was my age of deference ended. I now strive to be objective and evidence-based. To be fair, I always did, but I believe that the authorities were better at analysing the evidence than me. Now I realise that's not necessarily the case. Certainly not better than at analysing the evidence compared to the world-leading experts that we've talked to on the channel. The evidence has sometimes led me to places I would have preferred not to go. However, evidence has to be followed wherever it leads. Restrictions to dialogue are one of our current problems. A single narrative is handed down from the oracles in government and the regulatory bodies. Okay, you may be a professor of medicine with 50 years of experience and a dazzling research record, but we still do not want you to think for yourself. Just bow in subjection to those above. And we have talked to professors with more than 50 years experience, several of them, and many other professors and leading doctors. I go on to say in the foreword, this dictatorship is unacceptable. Open discussion must be permitted without threat or sanction. This book contains many such examples of open discussion. People in disagreement are, of course, welcome to present polite counter-argument, which, of course, we're always open to. However, counter-argument has often been replaced with fact-checking. That is in double inverted commas, of course. Abuse, insults, and threats to people's livelihood, and even, as in my case, life. I've had the police round twice with credible death threats. The top-down policies we were expected to obey are often generic in nature, one size fits all. Masks for all, lockdowns for all, genetic vaccines for all, no ivermectin for anybody. This is not what we should be doing in healthcare. Each patient should be assessed individually. Care plan then implemented on a person-by-person basis. Evaluation of care should be individualised, resulting in further assessment and ongoing care. Good healthcare is bespoke. When generic population directives are given, we demand the right to interrogate and question. An intervention which is good for me may be contraindicated for you. We are individuals and should be treated as such. Universities and scientific journals, once great citadels of freedom of speech and debate, are now subject to varying degrees of compromise. Some material may be taught, researched and published, while other ideas are subjugated and suppressed. Publication bias is alive and well. National regulators have been exposed as deriving much of their funding from financially motivated industry. In the UK, where I am, politicians appear to boycott those few representatives presenting counter-argument views, even when convincing evidence is presented. And we've seen this when counter-argument is presented. My Parliament, the House of Commons, is basically empty. Maybe a dozen people there or something. International bodies, once venerated, now appear compromised by political, financial and personal interests. These problems did not spontaneously arise at the start of the pandemic. With the clear white light cast by the retrospectoscope, looking back, it is now apparent that the control agenda has been ongoing and getting worse for arguably the past 2 or 3 decades. Let me know what you think the time frame is on that. I've put 2 or 3 decades in this text. Perhaps the pandemic and the extremes it has generated have brought invaluable illumination to what was a progressive situation. A good medical analogy might be an acute on chronic exacerbation that has made the diagnosis obvious. As men and women of empirical science, rational thought and integrity, we strive for an objective understanding of reality. We want truth. Truth must take priority over power-hungry individuals and institutions. Political and financial interests must not be allowed to subjugate the evidence base and our rational thinking that is predicated on such evidence. We must be led by the science, not by political and corporate vested interest. We reject any perverted science in favour of objective science. We seek to apply our science to the benefit of our peoples, optimising our intellectual and physical environment. We choose to base our health and medical interventions on established underpinning principles and the best expert interpretation of empirical research. We're based on scientific principles and research principles. This is what we want. We work for a future where science and medicine shall be of the people, by the people, for the people, and that it shall not perish from the earth. David Sackett proposed 3 essential components of evidence-based medicine: the best available evidence, expert opinion, and patient preferences. This book is consistent with this evidence-based medicine axiom of healthcare. The best available evidence is considered, expert opinion is given, and patient preferences are experienced and discussed. In the latter stages of this book, these individual preferences and experience are illustrated in some detail. The reading is not easy, as we learn of extreme individual suffering and of devastated lives. We hear from the bereaved. However, these personal accounts remind us of the stakes, the importance of what we are doing. This is not an intellectual interest or diversion. This is a matter that affects the real person in the real world, members of real family, parents of real children. Perhaps this book is important because people are important. And I've signed that John Campbell, and I've also put, if I have seen further, it is by standing on the shoulders of giants, which of course is from Isaac Newton, which just really to illustrate the fact that what I have come to see has been given to me by great thinkers in the field. So try to keep it cognitive. Don't get mad. Make things better for the future. That's what we're working for now. But at the same time, we do need some sort of truth and reconciliation because of the people that have died without justice, people that have suffered without justice. Sorry about my stumbling reading there. I'm not the best reader in the world, even though I wrote it. But there you go. Something to think about. Thank you for watching.